come in.
Hello. Hi.
Hello.
Welcome to a diabetes education class. My name is Michaela.
And my name is Talay.
I'm Madeline, Talay, and Michaela.
And I'm Ludo.
Nice to meet you.
Nice to meet you too.
Okay, so let's first start with, what do you guys know about diabetes?
Well, my doctor told me that I can't regulate my blood sugar, so I'm needing some assistance with that. But that's all I know.
And I know that I can't eat a lot of sugar.
Okay, all right, so let's get into what diabetes is. It's where your pancreas in your body does not release enough insulin to get rid of the glucose in your blood. So when your blood glucose is raised, your pancreas releases insulin to lower it. And your body is not doing that, which can cause a lot of other issues such as atherosclerosis, stroke over time, can cause hypertension,
Renal impairment, problems with your kidneys.
You said atherosclerosis.
That's a hardening of your vessels. So over time, the glucose in your blood is going to harden those vessels, which is going to make it hard for your blood to get through to the other parts of your body, such as, your feet and everything like that.
That's not good.
Yeah, and over time, it's going to eat away at your vessels. So altogether, it's just not good.
Okay.
So some things that you can do to help that are changing up how you eat. What we want to recommend you do is look at your carb intake. So when you're eating meals, you want to stay under 40 carbs. 40 carbs or under. And for snacks, you want to stay under 15 carbs.
Okay.
Okay?
Okay.
And a way to do that, you're going to try to eliminate a lot of those processed foods, sugar, stuff with added sugar. You also are going to have to start looking at like pastas, breads, all that has carbs, which is going to raise your blood sugar. So you're going to want to start looking at labels. Something you can eat a lot of: meat, vegetables, some fruit, whole grains. But you also want to be careful with the fruit, because there are fruits that are very high in sugar and will raise that blood sugar.
How many meals a day will I be, or should I eat?
So you should probably, stick to 3 meals and 3 snacks, but you're gonna want to make those meals small, So eat consistently every 2 to 3 hours to keep your blood sugar regulated. And keep
Okay.
under those 40 for the meals and under 15 for the snacks. And we have a couple of brochures here about, meal planning, which is a great thing to start doing. You want to go for like fresh stuff, but if you need to, you can also go to frozen. That's the next best thing.
Does that pamphlet have examples of these foods that we need to be looking for?
So if you go in here, this is carb counting, meal planning. It's gonna go through, it gives you different things for like breakfast, lunch, dinner, and the amount of carbs that are in each meal and each type of food. It has all kinds of foods, fruits, vegetables, anything that you can eat is in here, and it's gonna tell you. But also you can look at labels. So when you go to the grocery store, make sure you're looking at that label and keep an eye on the carbohydrates,
So we need to look at the
sugar.
carbs. Okay.
Yes.
But these have examples of meals that you can eat
Okay.
and how many carbs that are in them,
Yeah.
if you're having trouble coming up with something.
Okay.
And also, you guys want to start exercising more, because exercise is going to keep that blood sugar in control as well. So if you don't already have an exercise regimen, start including it. You want to at least get 30 to 60 minutes each day walking. Weight training is really good, because the more muscle you gain, the more it uses that glucose. So you want to start weight training to start building up muscle.
Okay. I do walk every day, so I guess I can just add weights to my walk.
Yeah.
Okay.
Are you walking 30 minutes a day?
I probably walk about maybe 15 or 20 minutes.
So maybe just add a little bit more.
Okay.
Or go twice a
Yeah.
day. Do 15 and 15 later at night.
I think I can do that.
Yeah.
Okay.
Yeah, if 30 minutes in one session is too much for you, then just split it
Break
up.
that up.
Yeah.
So I was told by the doctor that I have to check my blood sugar. How do I do
Yeah,
that?
how does
Okay,
that
so
work?
I'll show you. This is an example of a meter. This is another one. So they're all just a little bit different, but basically the same. This is the on button for this one. It's right here. This is the on button for this one. You turn it on. So we're gonna have all of our supplies ready. This is what you're gonna be pricking your finger with. So this is where the needle goes. And these numbers on it are how deep the needle goes. So 1 is the least, 5 is the most. So you wanna start slow and go up.
Okay, so I have a fear of needles. How big is this needle I'm pricking myself with?
It's very small, I will show you. So to do this, you just twist this part off. And the needle's very small.
Okay.
Start with the lowest and then, go up by that.
So we're gonna put it in there.
Same.
We're gonna start at 1, and you're gonna wanna go on the side of your finger.
Does it matter which finger?
Not necessarily.
Okay.
We recommend the 3rd or the 4th, but if you have one that you like better, that hurts less, or is more comfortable for you to do, then that, you can do whichever one you want.
So will it hurt?
It won't hurt a lot, just a little. But this pain right now is temporary compared to the things that we said that it can cause. So, problems with your kidneys, problems with your heart. You would rather be pricking your finger every day than having to deal with those further
When you
complications.
put it like that definitely, makes
So
sense.
you want to wash your hands before. Then if you have alcohol swabs, you can use those, but if those are too much money to purchase, then washing your hands will be fine. You want to prick the side of your finger, so right here.
Okay.
And then you want to wipe away the first little bit of blood that comes out and do, and then squeeze your finger a little bit if there isn't any more blood that comes out, but it might come out right after you wipe the other.
Okay.
And test that on a strip. So you're gonna put the strip in here or in here, depending on which meter you have.
So if I prick myself and I can't get any blood, do I prick that same finger?
You would, you can use the same finger, but use the other side and then turn it up to be deeper.
Okay.
So use 2 or 3 and use a different side or a different finger
Okay.
if that finger is hurting. So you put it in there, and then whatever the number comes up is what your blood sugar is. Did your doctor tell you what number you should have on your meter?
I know before meals. When I first get up, it should be between 70 and 110.
Yes, that's correct. So fasting, which means you haven't eaten, it should be
Okay.
70 to 110. But
Okay.
after a meal, so about 1 to 2 hours after a meal, you wanna check your sugar, and it should be under 200.
Okay, so I'm checking my blood sugar before I eat and after I eat?
Yes,
Okay.
yes.
Sounds good to me.
We also, there's some more things that come with diabetes and that you might have to take care of now. And so that includes getting your vision checked once a year, because diabetes can also affect your eyes.
Okay.
Another thing is diabetes can affect your feet, so you wanna check your feet, wear shoes as much as possible. And if you have trouble checking your own feet, have family members or friends check your feet, just to make sure you can, lose feeling in your feet and not feel if you've stepped on something and have an open cut, and the open cut can get bacteria in it and cause a bigger problem. So you wanna make sure that if you do step on something, that you get it taken care of. So you wanna check your feet. Probably, if you can do it once a day, but at least once a week.
Okay.
Another thing is keep, your supplies with you. If at all possible, have at least 3 days of supplies with you. So if you're running low on your strips, make sure to get to the pharmacy or ask some, family member to go by the pharmacy with you, just in case something happens and, if it's the weekend and you run out of your supplies, or if some snow snow comes and you can't get out, you wanna make sure you have enough supplies for about 3 days.
Speaking of getting to the pharmacy, do you guys have any issues with transportation into the
Yeah, I was
pharmacy?
just about to, I don't have any issues with transportation, but I try not to drive too often. So is there a service that can deliver it to my door?
Yes, we can get you, some information on services that do deliver your medications to your
And
house.
she said I need to have the supplies on hand, so I don't wanna be running low. Is
Yeah,
that correct? Okay.
yeah. So if you can't make it to the store, then we can provide you with a number of a service that can, deliver your medication
Okay.
for you. Or you can talk to your pharmacy, they might already have that service.
Okay.
So how do I know when my sugar is too high or too low? Cause I know sometimes I feel clammy and like kind of shaky.
So that means your blood sugar is too low and you need to eat something that has sugar and carbs in it. So, candy, like a small piece of candy, a little bit of juice, some honey, or you can buy,
They're glucose tablets. And these are good if you wanna keep them in your purse for when you're going out because they don't melt like candy and they don't need to be refrigerated. And this package lasts for about 2 years, so you don't have to remember to replace them. So if your sugar goes too low, just start low again, start with 1, check your sugar about 15 minutes later. If it's still low, take another one and do it in 15-minute intervals until you get above 70.
Okay, so what should I do if my sugar's too high?
So if your sugar's too high, you might be peeing a lot. You also might be drinking a lot, and but you want to keep drinking. One good thing is to drink a lot of water to flush all that sugar out. Another thing you can do is go for a walk, or go for a swim, go to an exercise class. Exercising can bring your sugar down.
but if you have
Okay.
if your sugar's going high a lot, too many times, you should definitely talk to your doctor, cause he might introduce a new medication to help with that.
Okay.
So another helpful thing you can do is write down what you ate and then what your sugar was 2 hours later. So you can remember, that'll help you know that you did take your sugar and also know what kind of foods bring your sugar up or don't bring it up.
Okay.
Mhm.
Wow,
Okay.
this is life changing.
Yes, I
Well,
feel
these
like
are
I know
meters.
so much more.
You guys can have.
I feel educated.
If you want to have any more education, you can go to,
This is about your medication, and this is just about diabetes in general.
Okay.
Might answer some questions that we might not have touched on, or that you wanna look for. You can also, call us if you have any other questions, call your physician, the website.
the American Diabetes Association website has a lot of information, has examples of meals, has everything we've said today. So if you can't remember something, you can call us, but if you wanna do more research online, they also have a number, it's a 1-800 number about, other programs like this. It can be, solely geared towards meal planning. They can help you come up with meals that you're gonna eat, or it can be all on medication, whatever you think you're having trouble with.
Okay, that's good to know, cause I was just given a lot of information. I don't know if it's all processed yet, but okay.
All right, thank you so
Well,
much.
thank you so
You're
much.
welcome.
Thank
I
you.
appreciate you
Good
taking the
luck.
time. Thank you.
Thank you so much.